Hello, welcome to the DMOSH Public Health presentation on infection prevention and control guidance for COVID-19 vaccination activities. My name is Jamie Jablanowski. I'm a public health nurse consultant with DMOSH, and the purpose of this training is to help provide you some additional infection control guidance that is needed during the COVID-19 pandemic. This includes physical distancing, personal protective equipment or PPE, and enhanced sanitation efforts to help you with the additional infection control policies or procedures that may need to be in place when administering the COVID-19 vaccine. So this presentation is going to start with some key overall infection prevention and control principles in the context of COVID-19. Then we're going to move into the preparation and planning phase, then on to the operational phase, and finally end with additional resources that might be helpful to you and your staff. So the three components of IPC guidance, this is based largely on a WHO document on infection prevention and control principles and procedures for COVID-19 vaccination activities. We're going to start with key overall IPC principles, preparation and planning phase, and again through the operational phase to kind of keep the flow organized, and also so you can easily revert back to this WHO guidance as needed. So with any vaccine clinic, you want to have standard precaution, which involves any kind of precaution related to the potential exposure of bodily fluids, which is in any healthcare setting. You want to follow standard precautions, and that relies on general healthcare assessments of the patient and how they present. In the context of a COVID-19 pandemic, there's also the need for additional infection prevention precautions. So some of these include that healthcare workers require specific infection prevention training for COVID-19 vaccine delivery. That can include this presentation. It can include, having your staff view this presentation, reviewing the infection prevention WHO guidance, but making sure that healthcare workers are aware of the specific IPC training specific to the COVID-19 vaccine. The public also requires specific measuring regarding IPC measures. We are all in this together. So having signage and posters to ensure that not only staff are physically distancing, but you have the patients and the individuals that show up for the clinic to be immunized are aware of what's in place as well. I think this also helps reduce any anxiety and make sure that everyone in the clinic, both staff and patients, are protected. We want a clean, well-ventilated environment to give vaccines. We want appropriate waste management and make sure this is done in the most safe way. We want adequate space to allow for the proper implementation of infection prevention and control measures. So a larger space allows for more physical distancing, and I think this is something to keep in mind when choosing a location for a clinic, if it's different than the clinic you're currently using. To allow, more space allows for more physical distancing, allows to set up different areas of a clinic, allows for increased signage. So making sure the space is there for the amount of patients and staff that you're planning to have on site, and then also managing that space appropriately. And then following any national or WHO guidelines, as things can often change and new guidance is released. So make sure you're staying up to date with the latest national WHO guidelines. So in regard to staffing, you want to make sure to appoint an infection prevention and control focal point. So this can be someone who's on site that day, shift to shift, that there's someone who's aware of all the latest up-to-date guidance on infection prevention and control, and also feels comfortable making sure that these policies are in place, that they can notice kind of any, things such as the chairs are too close together, any kind of potential breaks in infection control. Someone whose job it is to make sure that, staff are reminded of infection prevention control policies and procedures, and that the policies and procedures that are in place are implemented effectively. We want to ensure the adequate number of clinic staff to allow for time for IPC measures. So a normal clinic, say you're given the influenza vaccine in a non-pandemic setting, you might not need screening staff, you might not need staff additional staff to ensure that there's physical distancing, but you want to make sure that there's adequate number of clinic staff to make sure that all IPC measures are being followed. You want to identify staff to deliver IPC training to those involved in vaccination activities. And this includes not just healthcare workers, but also managers, vaccinators, cleaners, screeners. You want to make sure that even if they're not there to administer the vaccine, they're aware of physical distancing policies, need to wear a mask when in the clinic, and any other policies and procedures, so everyone's on the same page. And if staff are there, just for the day, that the manager on the shift is allowed to, has the opportunity to educate all those present. And then you want to identify healthcare workers for the supervision of vaccination activities and the monitoring of IPC practices. So we just discussed that a little bit, but the idea of having, I think it's important to have somebody that's responsible for the implementation and providing that real-time feedback as required. So there's a tendency sometimes for staff to maybe want to speak too closely to each other. They're breaking that, physical 1 to 2 meters of distance, and just to kindly remind them, we need to make sure that we're physically distancing, to make sure that chairs sometimes have a way of getting closer and closer to each other, making sure that they, maintain that proper distance. And everyone sometimes, especially during a clinic, needs a reminder to make sure that if there's anything unsafe or that might be breaking infection prevention protocol, that there's someone there to kind of provide an oversight and a reminder of the proper procedures to make sure that everyone stays safe. In regards to guidance, you want to develop and implement clear standard operating procedures for COVID-19 vaccination. This may include screening policies for COVID-19 signs and symptoms of staff and patients with clear exclusion criteria. So you want to make sure that you have policies in place that you're screening both staff and patients prior to entering the clinic for signs and symptoms of COVID-19, and that there's exclusion criteria, for example, setting a temperature of 100.4 degrees Fahrenheit as an exclusion that, there may not be entered the clinic, but I think having these policies and procedures clearly written out is helpful for both the staff and the patients. So everyone's on board, and if everyone's very clear about what the exclusion criteria is. You want to have key IPC measures to be taken by anyone in the vaccination area. So again, everyone knows what they're doing their part in preventing infection control. You want to have measures in place for safely administering COVID-19 vaccines, and this can be leveraged from some of the other documents that we're going to have shared in the past regarding the safely administering COVID-19 vaccines. There's a checklist you can use to make sure that everything is properly in place. You want to have policies and procedures regarding cleaning and disinfection of the environment. How often are you going to clean? What are you going to clean with? What supplies are needed? Appropriate waste managing. And this is also considering the increased waste associated with COVID-19 vaccination activities, because you'll have more PPE. You may have more supplies than usual, or more, for example, you may have more you may have a biohazard container at each station, and one vaccinator at each station. So therefore you may have, more supplies to manage than usual. Again, increased waste from the PPE as well. And you might have more patients to immunize in one time period compared to someone who's coming in for routine vaccination activities. You may have your biohazard, if you normally have, people coming in, sporadically to come in for routine vaccines, you may now have an increased number of biohazard containers. And so it's important that you know where you're going to store these, how often are they going to be picked up and disposed of properly, and that schedule may need to be increased. You want to have visual reminders. So I guess reminding of hand hygiene, respiratory hygiene, screening procedures. I'll have a couple of examples of those further in this presentation. You want to have training materials for staff, any refresher materials that may be needed, especially if you have staff coming to assist that may normally have or that may not have given vaccines. Maybe they've had an administrative role. Maybe they're coming temporarily to help out with the increased demand of vaccines. So making sure that there's training materials available, and as well as educational materials for the public. So vaccine information for the public. So here are some examples of visual reminders. Again, we have starting off with the screening criteria to make sure if you have these symptoms, you should be not entering the clinic. I think a lot of these visual reminders can also help ensure the clinic flow to make sure that you don't have, patients, the more organized you have your clinic flow, the less chaotic things will seem and the easier you have for infection prevention. You don't have, people are very clear of where they're supposed to be and of the physical distancing to avoid crowding. And I think that can be really important, again, especially if you have a surge demand for vaccine, increased number of vaccine individuals presenting to receive the COVID-19 vaccine. So again, you have this one by appointment only, in case you don't have, if you're having appointment only vaccines, you don't have people showing up, they know that they have to call first. Having it clear where the entrance is located, where the exit is located, making sure that's clear so you don't have people, crowding an entrance and crowding an exit, and have crowds by the doors, having close groups of people close together. We want to avoid that. The next one, we see the wear a mask, maintain the distance. It's in multiple languages. Again, just reminding of the social distancing and physical distancing, PPE required when in public. You want to have a designated waiting area. Again, when things are labeled and clearly delineated, the public knows exactly and staff know exactly where to go next. It maintains a flow, so you don't have, again, crowds of people, or it kind of helps to reduce any kind of confusion. And then again, here we have on the lower right, just as reminder signs for healthcare workers that what the screening is for them, that if they're symptomatic, that they shouldn't present to work. So moving on to environmental and engineering controls, I think these are really great to think through because they put the measures in place to make things easier, to allow for less having to verbally remind people that they kind of really help a clinic flow, but by just being there. So for example, assessing the layout of the building or area to ensure the following. So we just spoke about this a little bit, but having a clearly marked one-way foot traffic flow with a clear entry and clear exit areas through the vaccination clinic. So that's having, kind of, we see on this right, this is where you enter, this is where you exit, and having that on the doors when they enter to know this is an entrance only, this is an exit only. I think that can really help with traffic flow. I've seen arrows put up, so it's very clear one way and the other. I've also seen it down where there weren't these clear demarcations, or there wasn't clear signage, and it got kind of hectic, and there's crowds at the front door, there's crowds at the back door, there's crowds at the at a check-in station, people are asking questions, and this is something we really want to avoid. We want to have an adequate screening area, so again, an area that's designated to complete screening, and allows for again, that there's physical distancing in place, and this is allowed to happen. You want to have sufficient space to allow 1 to 2 meters of physical distance between all individuals in all areas. So you always want to be thinking, how many people are we planning to have in this area? What is the maximum number of people we're going to allow in this area? Who's going to monitor that? How are we going to enforce that? And making sure that you have sufficient space to make sure, including not just the patients, but also the staff that might need to be present. So multiple staff need to be in a room, making sure that you consider that, as well as the number of patients in a room. We want to have adequate ventilation of all areas. Not all areas may have a mechanical ventilation system. If there is one, it should be at 6 air changes per hour. If there isn't this, you want to make sure that the windows are open, as much ventilation in large of a space as possible. And you want to have medically equipped post-vaccination observation area for dealing with possible vaccine adverse reactions. And I've seen this done a couple of ways too. I've seen chairs laid out, and I'll have a couple of examples shortly. But you can have chairs laid out with one person in that area to observe those individuals. I've seen this conducted in school gyms where you have people up on the bleachers, and again, someone is there who's medically trained to see the signs and symptoms of anaphylaxis and appropriately respond watching. So this can be done, again, in several different ways depending on the space that you have. You want to make sure this is also included. You want to ensure an adequate number of hand hygiene stations in strategic areas to support the appropriate hand hygiene for public and staff. So you want to have, ideally, on each vaccination station, you have alcohol-based hand rub for the staff to wash their hands, and then you also have this for the public that are coming in. There's an opportunity for them to wash their hands when entering and exiting, after using the bathroom if there is one, waiting areas. They sneeze, they want to be able to wash their hands afterwards. And each vaccination station, again, this may not be possible in all areas. It may rely on soap and water. It really depends on what your clinic has, but just making sure that there is appropriate hand hygiene opportunities for both your staff and for the staff and for the public coming in to get vaccinated. You want to also kind of think through where we're going to put these supplies. Again, if you're using soap and water, you may need more space than if you have alcohol-based hand rub. You may also need to order more alcohol-based hand rub to ensure that it's in these different areas. You want to utilize signage, posters, floor markings, cones. All of these materials are, again, great to promote compliance with IPC measures. I've seen cones with ropes to ensure that people don't cross the line if they're in line for a certain vaccination station. Chairs are great. You already space them out. Making sure they stay spaced out sometimes can be a little bit more tricky, but making sure the chairs are adequately spaced, as you can see in this picture on the top right, to ensure that physical distancing is maintained. And again, I think having staff oversight is also important to make sure that, if you have a family coming together, they're not all crowding together. You don't have multiple families that recognize each other kind of coming together. Coworkers notice each other, so they decide to sit together, that the chairs are already spaced, and it sends the message that, this is something that we have in place and that, we expect to be followed. And then you want to ensure adequate space for vaccine storage or preparation. So again, space is just very important in the context of COVID-19 in general. But when thinking through your clinic and choosing a site, making sure that you're thinking through the infection control considerations in your clinic flow. So in regards to the vaccination stations, again, I've seen this done a couple of different ways, and I'll be showing them shortly in the presentation, but at least 1 meter apart, ideally with physical barrier between the vaccination stations. Again, this may not also be possible depending on your site, depending on the supplies you have available, depending on your clinic, but you really want to make sure they're at least 1 to 2 meter apart. Here on the right, I really like they have little green and red signs to hold up when the next person is there, so they don't have to raise their voice, and it's a very clear, okay, you can come next. You don't have someone just kind of crowding the table while one person is being vaccinated. I think sometimes with COVID-19 vaccine, people are anxious to get the vaccine, and it kind of helps reduce, again, the more organization, I think, the less anxiety. You want to ensure adequate cleanability of the screening area, the vaccination station, and the waiting area. So you just want to make sure that all the equipment you use can be wiped down, and that it is getting wiped down. There's supplies available to be able to clean the areas that you're using, adequately, to make sure that things are just staying, clean, and avoiding any potential contamination. You want to establish an appropriate waste management system, including the safe disposal of waste and sharps at each vaccination station. Ideally, again, you want to have a sharps disposal container at each location. You want to have the sharps disposal, the sharps container, you want to have that at every location as close to where the vaccine is being given as possible. You don't want to have one sharps disposal container for multiple things, where where a healthcare worker gives a vaccine and has to get up and walk with that vaccine. Ideally, you want to be able to give that vaccine and immediately and safely place it in a sharps disposable container, and have that be, not a very quick action. So it's not this, you don't have to walk, you don't have to travel. Having the garbage on site and having a waste disposal is also helpful at each vaccination station. I don't think you can see that here. I think they have one maybe at the end of each table. But again, if you're choosing to use gloves, that you can dispose of them right there. There's not a lot of walking with waste, or potentially interacting with other people while you have waste in your hand. I think this just helps with just injection, preventing needle sticks and infection control, but also general just good infection control practice. So here are some examples of engineering controls. So in this case, this could be a waiting area. This can be an observation area where you have staff. I think it's important to have staff observe the waiting area. You can see that there's arrows showing this is the exit and you go this direction next. The chairs seem to be even a little bit more, maybe than 1 to 2 meters apart, and I think that's great because in case there's any crowding, you want to as far as possible. I think it's helpful, and again, it sends a message right when someone walks in that this is what's in place and this is what's going to be expected. Here's another great example of engineering controls for vaccination stations. What I really like this, you see a sharps container at each station. You see gloves and hand hygiene supplies at each station. You see a waste bucket at each station. And then you also see these great dividers that are, they're washable. They're able to be cleaned, which I think is great. So you have this physical barrier where these immunization stations might be a little bit closer than we've seen in other pictures, but there's the physical barrier in between them, which I think is great. And I think if you can have ones that are washable and then also allow for patient privacy, even better. You also see a hand hygiene station where essentially the patient would come up, wash their hands, and then go to their station. Here's another example. I've seen this quite a few areas where people have access to large gyms. You have the cones roped off where each patient is waiting online. They're physically distancing online. There's signs to tell them, wait here before your next immunization to allow for distance between the patient currently being immunized and the patient that's next. You see here on the tables, the vaccination tables are also at least 1 to 2 meters apart on her station. You see cleaning supplies, you see alcohol swabs, you see hand sanitizer. Both her and the patient are wearing a mask, which is appropriate. You see her documentation. She has a safety needle where she can immediately cap the needle before placing it in the sharps container. So I think this is all really well done, and I think especially I've seen clinics like this seeing up to 1,000 patients per day, and it's smooth. There's reduced anxiety. There's not a lot of confusion because things are already using engineering controls are clearly marked out for both the staff and patients, and it keeps things organized. And then you can see when things are organized, it's also much easier to see any kind of breaches in infection control practice because very quickly you can see, oh, those chairs are two together, or I think something was moved. So I think this is also another great example, especially for a large-scale clinic. Here we have another example of using engineering controls for the waiting area. You might have people that need to wait outside the clinic until it's their turn. Again, putting the chairs separated apart. I think providing the chairs, where normally people can stand, again, there's a sense to crowd, especially towards the beginning of a line. People start crowding because they're anxious to get in. But having chairs that are 1 to 2 meters apart allows for people to sit and ensures that that space, as much as you can, is maintained. And here's another example. This one's nice and numbered. It has the cones. These tables are very well spaced. Again, you see sharps container, cleaning supplies, hand sanitizer at each location. Each healthcare worker is wearing a mask. They have their supplies there. They have a waste basket right there. So everything that's needed almost operates its own little unit, which I think is most effective. And you also see someone there. They have sashes to show that they're staff, and it looks like you have someone there also to kind of assist with any questions, with any, there one person is walking around to kind of help with any issues. I think that can be helpful too, instead of having people walk all around. You have one person designated for oversight. It looks like there's someone in the back too who may not be medical, but designated as oversight, right? Helping patients, direct them. Now here's the exit, here's the entrance, this is where you go next, to ensure that one-way clinic flow. And again, here's another example, sharps container at the location. They have hand hygiene supplies, the healthcare workers wearing a mask. Here you don't see a waste receptacle at the table. I think that's the preference, is to have waste available. She does have a shield in the event she needs it. I think that's great. Again, not required. Only a medical mask is required for the immunization, and we'll cover PPE shortly. But again, you can see the station. Everyone has their station. Looks like a smaller clinic, and things are adequately spaced, and there's all the supplies needed at that table, especially the sharps disposal. So moving on to the list of infection prevention and control supplies needed, medical masks for healthcare workers and for individuals to be vaccinated who may not have a mask. So it's always good to have extra medical masks for those who may have forgotten their mask, forgot it, when they arrived to the clinic. Maybe it got soiled on the way. maybe they lost it or dropped it. I think it's important to have an extra supply and have that close to the screening area so it happens as soon as someone walks in, there's the opportunity. I forgot my mask. Well, here, you can put one on in the beginning instead of waiting to come any further into the clinic. PPE, so eye protection gowns and gloves, and this is only needed if there's a suspect case during the screening process. You want to make sure that you do have a full set or a few full sets of PPE in case there is an emergency response. In case someone does present with a fever, you want to make sure that you have the supplies needed to tend to that patient. You want to have soap, clean water, buckets of soap and water if the sinks aren't available, and disposable or clean towels if using soap and water. Alcohol-based hand rubs are also great. Supplies for temperature screening, tissues, waste bins, and waste bags. And again, I think the important point here is making sure that with the increased waste of PPE, of having individual vaccination stations, that you have, individual waste bins, and kind of think through the process of how you're going to manage the waste at the end of the clinic. Safety boxes, preferably puncture and leak proof. So again, this is very important for the safe disposal of sharps, and we're going to talk a little bit more sharps towards the end of the presentation. And then you want to have cleaning and disinfection equipment and products to make sure that you're keeping your area clean, that you're able to wipe things down. Visual reminders and signage and floor markers, and again, the cones, signs, spots on the floor, X's on the floor, whatever you think is best for your clinic. I think it's helpful. And again, I think, the visual reminders, extra chairs, whatever you can do to put those engineering controls in place is going to make adhering for both staff and patients to IPC principles and IPC guidance a little bit easier. And then physical barriers to aid in ensuring that space. So like we discussed, chairs, having the tables farther apart, any kind of, you want to use ropes, or sometimes I've seen tape used to designate an area. I think that can all be helpful. So moving on to the operational phase. So this is when you're actually, you move past the planning phase, and now you're actually administering the vaccines. So you want to use a daily checklist to monitor and ensure that the IPC and other safety measures are adhered to. So having a quick checklist, the person who's in charge in the morning, just going quickly through the checklist, things are appropriately spaced, everyone has everything they need, everyone is aware of what protocols are in place for this day. If there's new staff, if they have any questions, they're all addressed. Any new changes that might happen that staff are addressed. So I think a daily checklist can be very helpful. Just as a reminder, when we have checklists and we go through them, sometimes it makes sure it's very quickly to notice anything that might be out of place. You want to screen all staff and individuals arriving for vaccination for signs and symptoms of COVID-19 at the start of the shift. So you want to make sure that you're screening individuals when they're first coming into the building and staff before the start of a shift for any signs and symptoms of COVID, and then addressing that appropriately. We don't want to wait until the individuals are too far into the building, or until staff have already arrived, maybe for a couple of minutes, or staff went into a break room. You really want to make sure that that's happening right at the entry point. You want to implement any robust scheduling process for vaccination appointments to avoid overcrowding, facilitate physical distancing, and ensuring that you can adhere to IPC practices. So again, I think that with COVID-19, you might have an increased number of patients than maybe for other vaccinations or routine vaccinations, and even more maybe than flu clinics done in the past. So you want to make sure that you have set up scheduling appointments and set up the space to avoid overcrowding. And this is what I've seen, unfortunately, especially in the beginning, some of the vaccination clinics that I was present for, that there was overcrowding or people showing up to the clinic with questions and crowding at the door. Again, because there's a lot of anxiety, I think, sometimes, especially in the beginning of a clinic when people are anxious to get the vaccine. You want to limit the number of people accompanying individuals coming for vaccination to one person and only for those needing assistance. This may vary on a clinic-to-clinic basis, but ideally, you really just want the person coming back who's getting vaccinated to come into the clinic, unless, or if they need assistance, having that one person come with them. You can always ask, can you please wait outside? Can you please wait in this area? Again, just to avoid overcrowding, the less people, the better with COVID-19. So whatever you can do to kind of limit the number of individuals, I think is helpful. So hand hygiene for clients. So when should clients perform hand hygiene? when they're coming in for vaccination and when they're leaving. So that may be a suspended bucket at the beginning of the clinic. It may be antibiotic hand rub, an automatic dispenser in the beginning. Again, this will depend on what supplies you have, how your clinic is laid out. You'll have functioning hand hygiene stations, again, entrance and the exit. And again, these might look different. So I have two examples on the right, and it really will depend on your clinic and your supplies available, but making sure that these are available to the clients. And then for staff, so I think a good question is, when should staff perform hand hygiene? So they should perform hand hygiene at the start of a shift, when they're leaving, putting on and removing PPE, so they're taking off their mask, putting on their mask, preparing the vaccine, and between each vaccine administration. And I'll have an example, a really nice example of that shortly. A little discussion on wearing gloves. So gloves are not required for vaccination. Some clinics, some individuals choose to wear them. Again, regarding standard precautions, if you're assessing the skin and you feel that there's a need to wear gloves, then that's appropriate. But if you are wearing gloves, you want to make sure that you're changing your gloves between each patient and washing your hands. So that needs to happen. You can't wear the same pair of gloves for multiple patients. Sometimes I see that in the media, but that's not good infection control practice. And you want to make sure that you're not putting alcohol-based hand rubs on gloved hands. So you're not wearing the same pair of gloves, then using alcohol-based hand rubs. It can break down the integrity of the glove, and it's not good infection control practice. So if you're not wearing gloves, you want to make sure, again, you're washing your hands between each patient. And if you are wearing gloves, you're taking off your gloves, washing your hands, and then putting on a new pair of gloves. I also wanted to mention that alcohol-based hand rubs are preferred because they have advantages for logistics, efficacy, and tolerability. I think, it's always said that soap and water is preferred, but in most circumstances, the alcohol-based hand rubs are, because they're very easy. It's easy to have a bottle right at the point of care. They're made so that you have to rub them in for a certain number of times to make sure that the hand is covered. So I think it is, if you do have the choice between the two, you really want to go with alcohol-based hand rub. So here's a great picture from WHO guidance of kind of the clinic flow. The person comes in, they get their injection, the vaccinator performs the injection, they discard the needle, they apply a Band-Aid, the patient leaves. Record anything you need to record, and then you want to wash your hands or remove your glove and wash your hands before the next person walks in. So I think this is just a really nice visual at what point it's required to wash your hands and at what point you should do that. And that should be, before the patient, before you clean the skin, before you touch the patient. So the PPE required. So the required PPE for staff completing screening is a medical mask. As you can see, it's those blue medical masks. Required PPE for the staff giving the vaccine. Again, it's a medical mask. And we discussed the gloves are not indicated for IM or intradermic injections, but they are used. You would want to use gloves if there's any skin breakdown, and that's going to rely on the health care worker assessment. And again, just adhering to standard precautions. But again, sometimes gloves are used, gloves are not used, but they are officially, from the WHO guidance, they're not required. And the person receiving vaccine, they should be wearing either a medical mask or a cloth mask. In regards to vaccine administration, there's a great UN vaccination skills checklist, and this applies for all vaccines, but it's a great refresher on the appropriate administration of vaccines. It also includes a link and a review of the management of potential anaphylaxis after a COVID-19 vaccination. There's also a separate document on this, which I think is a great to review, and also a training video on the management of anaphylaxis post-COVID-19 vaccination. And all these resources are available at the website below. But I think it's really important that these materials are a great resource. They're a great review for any staff planning on giving a COVID-19 vaccination. And again, especially the management of anaphylaxis, because there's been some updates, and I think it's important to have this review. In regards to injection safety, you want to procure and use safety engineered injection devices. So auto-disabled syringes, needles with Sharps injury protection features. So the best example I can give you is visual here on the right. These needles are nice. You can just quickly cover the needle after they're used. There's some needles that automatically lock after they're given. If these aren't available, you want to use sterile single-use syringes and needles. Again, just maintaining infection control. But again, we want to protect the person giving the injection and we want to avoid any potential for needle sticks. So if you can obtain, the safest needle possible, that would be ideal. You want to perform hand hygiene before preparing the injection material. So again, if you're preparing the vaccine, you want to make sure you perform hand hygiene before you draw it up. You want to prevent contamination of the vial by wiping the septum with 70% alcohol. So you want to make sure, a lot of times the easiest way to do this is to use a alcohol swab, one of those single-use alcohol swabs. You rip open the package, you scrub the hub, you scrub the top of it before piecing the vial and allowing it to air dry. And this is because you never know when your hand may touch the top, and you want to make sure that if there's 10 doses in that vial, that there's no contamination of any of the medication inside the vial. And this is good practice across any type of drawing up of liquid out of a vial. And then you want to pierce the septum with a sterile needle every time it's used. So again, you want to make sure that only sterile needles that have not been used before are entering that vial when you're drawing up the vaccine. Continuing with injection safety, if multi-dose vials are used, with COVID-19, it looks like many of them are going to be multi-dose vials. You want to ensure measures are in place to avoid contamination and that they're consistently implemented. So again, a sterile needle should be used every time the multi-dose vial is pierced. A needle should never be entered into a multi-dose vial twice. You never want to leave a needle in the stopper of the vial. So, pushing the needle in, walking away, having a conversation, it should really be drawn up right then and there. You want to label the multi-dose vial with the date and time it was first used and discard at the required time. This is especially important with temperature-sensitive or light-sensitive vaccines, that, things are monitored to make sure that expired doses are not given and that it's used, that you're able to give the doses. So if you have 2 vials and one may expire more quickly than the other, you can choose maybe to use that vial before opening another vial, things like that. Just kind of keeping aware, again, to avoid any kind of vaccine wastage. And then you want to discard the multi-dose vial immediately if sterility is questioned or compromised, or if it isn't properly labeled with the original entry date. So if you have an unlabeled vial, you don't know if it's from yesterday or the morning, you have no clue when it was used, you want to dispose of it appropriately and immediately so it's not used and it may not be an effective vaccine. You want to follow all manufacturer guidelines for preserving, reconstituting, and administering the vaccine. Again, each vaccine is going to have its own guidelines. I think it's very important to be well aware of what those guidelines are to make sure that you're always giving an effective dose of the vaccine. For skin preparation at the site of injection, you want to clean visibly dirty skin with water. And for all other skin, you want to, and most of the time, you're going to be disinfecting skin with 60 to 70% alcohol-based solution. And you want to make sure the alcohol is dry on the skin prior to injecting. So it's pretty quick that the alcohol dries. Again, most often you're using an alcohol swab as seen here on the right. You want to rip the swab open, clean the site, wait for the alcohol to dry, and then inject. In regards to environmental cleaning and disinfection, you want to prepare each injection in a clean, designated area. So again, if you have a multi-dose vial at your station, you're going to have a clean area. You just want to make sure that your station stays clean. So there's no, you don't have, say, all bandages are in one area. You don't have someone leaving a tissue where you're about to prepare the vaccine, just making sure everything stays clean. You want to perform regular environmental cleaning at least twice per day. So again, making sure your area stays clean, making sure, the seats are wiped down that the patients may be sitting on, countertops, phones, faucets. These are all highly touched surfaces that may be used, doorknobs. You want to make sure they're not forgotten. So if you have a restroom at your clinic, if they have to enter through a door, you want to make sure these things are cleaned. If you have a staff phone that's using, you want to make sure that's cleaned. And again, all the surfaces, areas where people are touching things. Every patient's going to come down, they're going to sit down, they're going to touch things, and making sure this area stays regularly clean. Moving on to sharps, which I think is very important in any vaccine clinic, but you want to make sure you discard used syringes as a single unit immediately. Again, so you want to give the vaccine and dispose of it in the sharps container. You want to collect used syringes and needles at the point of use, an enclosed sharp container that is puncture-proof and leak-proof. So most often you're seeing these red containers. They're really good at designated, having a fill line of exactly where you should fill it. It should only be 3/4 full. So you can see in that fourth picture, you want to avoid overcrowding, which unfortunately I've seen sometimes, especially in the hospital setting. The sharps are all the way to the top, and you really want to avoid someone going to throw a sharp in, potentially getting stuck by a needle. So you really want to make sure that those containers are closed and properly disposed of as soon as they're 3/4 full. And again, that's protect the healthcare workers and maybe someone who may be coming in after you. You want to keep your hands behind the sharp tip. So again, when you're throwing, away with the needle down. Again, just to make sure that everything's being done safe, and you don't want to be walking. So ideally, if you can have a container, sharps container, directly where you're administering the vaccine, so you can quickly dispose of the needle and the syringe, that's ideal. You want to seal the full sharps container and store in a secure area in preparation for transport and final disposal. After closing and sealing the sharps container, you want to secure and dispose of as soon as possible. So you don't want to have filled sharps containers laying around. You don't want them stacking up underneath your station in a corner where people may be able to access them. You want to make sure you have a plan for the appropriate disposal. And again, this may be different than regular vaccine clinics because you may have more containers than usual. And you may need to kind of think through, where are we going to store these if they're waiting to be picked up, if they're waiting to be disposed of. You never want to open, empty, reuse, or sell containers. Once they're used and closed, they should stay closed and then be disposed of. And again, making sure you're doing it to your national guidelines. They shouldn't be, ideally not transported, in the back of someone's vehicle, or, stored in an area that other people may have access to, or stored for a long period of time. So thank you for the presentation, for attending today. I hope this was helpful in helping to prepare for a COVID-19 clinic and vaccinating your patients. Here's a list of additional resources: NAISS, CDC, WHO, all has great resources. They're being updated regularly, so I think it's important to keep checking. Here's some additional WHO guidance that could be looked up in regards to COVID-19 vaccination. And again, thank you for attending.